over time, even though we've recognized that there is some inherent heterogeneity in gastric and esophageal cancer, a lot of our therapies, especially the systemic therapies for metastatic disease, have taken a one-size-fits-all approach. And some of the work we've done in collaboration with others has been to look across these cancers with different genomic technologies to understand the different types of cancers and the different subclasses that are present, and even beyond the different subclasses, to think what are some of the real salient features of these different tumors, what are some of the particular oncogenes that might be turned on in particular cancers that could give you some guidance as to optimal targets for new therapies. There are other classes of gastric cancer that have really abrupt and marked chromosomal aberrations, where you get sort of mixing and matching in different pieces of chromosome and many copies of certain cancer-promoting genes. And so in those, there are a number of different genes that get overexpressed and amplified that are often targeted by some of the either existing or emerging inhibitors. And so as you see, sort of there's different classes of cancers where the underlying mechanism of how these tumors emerge is different, and in that setting there may be, our thinking is there will increasingly be different ways to develop therapies, and maybe even that looking at existing therapy in light of these changes might help us understand where existing therapy may be more or less effective.